The American Medical Association just published a peer-reviewed clinical trial. Single dose, Schedule 1 drug, cocaine addiction. The result? More abstinent days, fewer relapses. That drug is illegal. There is no FDA-approved medication for cocaine use disorder. Zero. I'm Patrick Nolan. Today on Pat Talks Law, the psilocybin study that landed in JAMA and the federal scheduling block that keeps doctors from prescribing the treatment. On Thursday, the American Medical Association published the findings in JAMA Substance Use and Addiction. The headline, "A single dose of psilocybin paired with talk therapy appears safe and effective for treating cocaine use disorder." The researchers came from the University of Alabama, Johns Hopkins, and the Karolinska Institute. This is a serious lineup. This is not a fringe paper. The design, a randomized, quadruple blind, placebo controlled trial. 36 participants who met the diagnostic criteria for cocaine use disorder. Talk therapy 1 month before, 1 month after, and one all day session with the drug, either psilocybin or placebo. Abstinence verified through urinalysis. The findings. Compared to placebo, the psilocybin group showed significantly greater percentages of cocaine abstinent days, higher rates of complete abstinence, a decreased risk of cocaine lapse over time. The study also did something psychedelic research has historically failed at. The participants were not all wealthy and white. Black patients and patients of lower socioeconomic status were intentionally included. That is a first for this kind of trial. Psilocybin is a Schedule 1 controlled substance under federal law. The legal definition of Schedule 1 is that the drug has, quote, no currently accepted medical use, end quote. The American Medical Association just published evidence that it does. Zero medications. This is not a one off. The same journal published a study 2 months ago showing one dose of psilocybin combined with therapy produced significantly higher long term abstinence from cigarettes than nicotine patches. Other peer reviewed work has shown reductions in alcohol use and signals on opioids. The need is real. Federal health data shows fatal overdoses involving methamphetamine and other stimulants rose nearly 5 times between 2015 and 2022. There is no FDA approved stimulant addiction medication. Not for cocaine, not for meth. None. The federal government is already paying for this research. The National Institutes of Health put $2.4 million into psychedelic studies for methamphetamine use disorder. The National Institute on Drug Abuse added another 1.5 million in 2023. The Trump administration has also taken early steps to explore the therapeutic potential of Ibogaine, a psychedelic that some advocates have called a life-saving treatment for veterans dealing with PTSD and substance use disorder. Federal money is flowing, peer-reviewed evidence is stacking, but the law has not moved. Psilocybin stays on Schedule 1. A doctor who prescribes psilocybin for a patient with cocaine use disorder is committing a federal crime, no matter what JAMA published this week. Here is what to do with this news. 1. Do not self medicate with mushrooms. The trials work because of structure, therapy before and after, medical supervision during. Without that, you are not running the same protocol. 2. Watch the rescheduling docket. The DEA's Schedule 3 cannabis rulemaking is the warm up. Psilocybin reform sits behind it, and the JAMA studies are the evidence supporting the next move. 3. If you are a clinician, you cannot prescribe Schedule 1. You can refer patients to a registered clinical trial. Clinical trials. .gov is the index. That is the legal pathway right now. 4. Track the journal, not the headlines. JAMA Substance Use and Addiction is the source. The trial is published. The data is public. Bottom line, the AMA just published evidence that a Schedule 1 drug can treat a condition with no FDA approved medication. The federal contradiction is the story. The trap stays open until the law catches up to the science. I'm Patrick Nolan. This is Pat Talks Law. If this belongs in your feed, like the video, subscribe and share it with a clinician or anyone tracking federal drug policy.